Hello, and thank you for joining us today. Today, as we celebrate Mental Health Awareness Month of May, our mental health talk today will be discussing suicide awareness and prevention. According to Mental Health America, suicide is the 10th leading cause of death in the US and second leading cause of death among people of ages 15 to 24. Today, we want to amplify the message that you are not alone. We will be discussing the warning signs, risk factors, prevention, and how to help. Our viewers have an opportunity to ask panelists a question along the way, so please feel free to express your comments or have any questions and send us a private message. We would first like to welcome each of our panelists, and thank you so much to each and every one of you for joining us today as we participate in this very important conversation. I'd like to take an opportunity to introduce you to our listeners. Amy Shield Jones, Senior Consultant of CCSI. Amy Shield Jones brings depth and a wide breadth of experience to capacity building and change management strategies. In her work as a school counselor, Amy spent 10 years developing expertise and practical approaches to prevention, resiliency, and fostering well being that is now applied across sectors. Amy is a committed youth and family advocate, a systems thinker, and has consistently applied these core principles to accelerate practice transformation. The core of her work includes sustainable system transformation grounded in trauma responsive principles, positive youth development, and resilience enhancement with an equity focus. Specifically, Amy oversees the Consortium on Trauma, Illness, and Grief in Schools, a regional collaboration of comprehensive training and integrated crisis response network serving participating districts for over 20 years. She is a continuing contributing editor to the Reaching Teens Toolkit Second Edition, where she created a portal for education professionals aligned with SEL competencies. Thank you for joining us today, Amy.
So grateful to be here.
Next, I'd like to introduce you to Manny Jade Garcia. Manny Jade Garcia is a psychotherapist, science communicator, educator with Trauma Center at Genesee Valley Psychology. He's a community-based researcher, evaluator at Social Insights Research. He's dedicated to improving access to physical and mental health education, assessment, and interventions for monitorized and underserved groups, always in close partnership with the communities he serves. Manny Jade is currently completing his doctorate in clinical psychology. His dissertation project describes how Black, Indigenous, and Latinx young men and women living in the poorest areas of New York City are using the practice of parkour to promote community, leadership, and health. Manny also researches the effects of language-based exclusion on deaf mental health. Manny is a co-founder of Black in Mental Health on Twitter at Black in MH, Black in Data, and found director of Refugee Work Group at Refugee Work Group, a movement dedicated to bringing safety, accountability, and healing to academic and professional spaces. Thank you, Manny, for joining us today.
Hi everyone, very excited to be here with all of you.
Next, I'd like to introduce you to Samantha S. Colson. She's Director of Training and Programs at NAMI Rochester, the National Alliance on Mental Illness. Samantha is an emerging leader and mental health champion. She is an advocate for ending stigma around mental illness, substance abuse, and suicide. Samantha believes that having an understanding of mental health in an early in life is key to preventing and treating mental health problems as they develop. During her professional journey, she has focused on promoting positive mental health and well-being across the lifespan. Samantha holds both a master's in social work and Strategic Leadership from Roberts Wesleyan College. Thank you for joining us today, Samantha.
Thank you for having me.
So to begin our conversation, it's worth mentioning that a suicide attempt is a clear indication that something is gravely wrong in a person's life. No matter the race or age of person, how rich or poor they are, it is true that most people who pass on by suicide have a mental or emotional disorder. The most common underlying disorder is depression. 30 to 70% of suicide victims suffer from major depression or bipolar disorder. So my first question for each of our panelists is, are there myths about suicide? And what is the most common misconception or myth that you hear about suicide that we really should ensure that people understand that it is a myth? So, given in the order that we introduce our guests, Amy, do you mind being first to answer that question?
No, it invites me to be able to do the easy one, right? Which is really making sure that everybody understands that if we're worried about someone in our lives, asking if they are thinking about suicide or have thought about dying does not put ideas into their head. That we really do want to make sure we give voice to our concerns, that we can normalize the experience that these thoughts are actually really common and invite the conversation. Because I promise you that if a person is struggling and it is not on their minds, they will tell you, they'll communicate, no, that's not it for me. Here is what is going on, perhaps. But if a person is, if they've been struggling with that, it often brings a sense of relief and an opportunity to really engage in a turning point, to receive some support with whatever it is that they may be leading to some of their struggles.
Thank you. Manny Jade, did you have something to add to that? Oh, we're having a little difficulty hearing you, so we'll move on to Samantha while we focus on that. Samantha, have you heard of any other myths or misconceptions that have been said out in the community that we should pay particularly attention to?
Yeah, I've often heard that folks will say that it's a selfish act and that the individual is not thinking about those around them or their family. How can they do this? They have such a perfect life. And we really need to understand that suicide is an individual decision, that they are more concerned about their own emotional well-being. It is about how they are feeling and how they are doing, and they're trying to ease that burden and that pain for themselves. In that moment, they're not thinking about how it's going to impact or affect mom or my kids or my family or friends. They're really concerned about how to end that pain. So we just want to let folks know that it is about, as Amy mentioned, asking that question and having that relational conversation with them to really see where they are, because you'll be able to provide that support and get them the help that they need.
That's an excellent segue into my next question. As according to Mental Health America, 8 out of 10 people considering suicide give some sign of their intentions. And people who talk about suicide or threaten suicide or call suicide crisis centers are 30 times more likely than average to succeed in their act. I'd like to talk about the warning signs that individuals may see in their own people around them that perhaps they may not understand that they're warning signs, but by us talking about it, hopefully can give that kind of education of the fact that these are warning signs and should be taken seriously. Samantha, can you talk about what some of those warning signs would be, as you just expressed a moment ago?
Sure. So one of those things would be talking about wanting to end their life. If they have expressed wanting to die, wanting to kill themselves, researching if you happen to have access to their patterns in search history around wanting to end their life, how to do that. You want to pay attention to that. Something else is definitely those changes in behavior that we see. And I say that with changes in behavior as in changes in their character. So right now with COVID, like of course kids are wearing their pajamas all the time. They're just rolling out of bed and getting on camera for school or for meetings that they have. That's given the times. But if you have someone that's usually well put together, not presenting in the way that they used to present, not engaging with friends and family, or maybe even online like they used to, and you see that change in behavior, you want to be aware of things like that. Of course, we have changes, increases in use of substance use or drug use, alcohol use, things of that sort that we also want to pay attention to as warning signs.
Excellent, Manny. Jade, thank you very much for rejoining us. We're talking about warning signs and what kind of warning signs should be taken seriously as individuals talk to their loved ones about how they're feeling. Samantha mentioned really coming out and saying, I'm really thinking of ending my life. But I'm wondering if there are other signs that individuals should pay attention to for those who may not be so bold enough to let individuals know of their intentions.
Can you hear me now?
Yes, yes.
Yeah, okay. My computer is on a slow death path. So I'm gonna, if it's okay, I'll combine answers to both questions.
Yes.
I think so. I'm looking at the latest literature. I think one of the myths is that signs are the same for everyone, and actually signs can vary by identity factors. For example, by race. And so some of the research I looked at was really eye opening. For example, among Black youth, um, interpersonal factors played a role more than among like Hispanic or Asian youth, right? So interpersonal meaning things out of your that are not in your control, external to you, versus intrapersonal, which is like depression or isolation or something like that. And so those are often treated. Often people look at suicide and what leads up to it, and the focus is on the person, what's happening with the person, and what's not looked at is the external environment and how that's affecting the person. And so leading to your second question, there's a big push now in a lot of researchers that look at suicide among minoritized groups to look at a sense of belonging. Right? Is a person behaving in a way that provides evidence that maybe they feel like they don't belong for some reason? Again, the focus not being solely on the individual, but the external factors. And so that could be something to look for. One of the things that's misunderstood, for example, among Black young men, is that behavior that would be described as violent is not counted as a risk factor for suicide. And there's newer research suggesting that that could be a really good indicator. You know, if a person is getting involved with things that, my older brother, for example, to share a personal story, got involved with gangs when we were younger. And so you could make an argument that that's a very slow form of suicide, right? I mean, he spent most of his life in prison as a result. And you may as well be dead at that point. You're separated from society. And so that's something different that I like, that I found in the literature. It's something to look out for.
So really looking at external factors as well as the internal feelings of an individual that may accelerate perhaps someone's intentions.
Right. Or it sometimes feels like we look at the effects and not the causes.
Mm-hmm.
Of what might prompt the person. So a person's depressed, the person's isolating themselves, a person's doing XYZ, and where it feels like a lot of the research stops there. It's important to know that, and then the next question that's possibly more important, it's harder because it's a societal societal factor, is what's making the person depressed? What's contributing to that? What's contributing to a person are they isolating themselves, or are they being treated different than other people? Are they being isolated by society? And so that I like that view because it's looking at multiple contributing factors.
I have found that the types of, I'll call them emotions or feelings that individuals would have that may lead up to this is helplessness, the hopelessness, and some of those types of feelings have contributing factors from our environment. One of the things that we are looking to promote with this conversation is how do we change that viewpoint by offering opportunities, offering options, and offering positive sentiments as people change both themselves and their environment. So, with that, Amy, I wanted to ask you, given some of the experience you have, what kind of language is surrounded after someone may be brave enough to let another person know that they do have intentions on a suicide attempt?
Sure. And I can really draw, from what Manny, Jade, and Samantha have already shared, right? And really highlight the essential quality of belonging and connectedness. So we want ideally these conversations to be happening as early as possible. So certainly the conversation and recommended action would look very different if the possibility for suicide was imminent. If an act has already started, perhaps somebody is talking with you, but they've maybe taken an ingestible already, versus if you are just being connected with a person and you're having ongoing concerns that you're inviting a conversation. So I think if you have the time and space, if an emergency intervention isn't required, to the degree that you can, you want to normalize, support, and validate what that individual is expressing to you. We don't have to have answers to problems. What we want to demonstrate is I am here with you. I'm here in support of you. And together, perhaps, we can do some shared problem solving. Because that critical aspect of helplessness and hopelessness, Mary, that you called out is that real belief that my problems are too big for me to solve. And no matter what I do, it can't be different. So we want to create environments where we can hold hope and create little moments, little cracks in that facade that no, change is possible. We can increase capacity. There can be work that can be done in terms of supporting an individual's internal experience, but we can also move levers, and we should, to decrease those external stressors. Now, I do a lot of work with kids, families, and schools, right? So sometimes we're looking at direct environments of a school classroom, an instance that's occurred where a young person has lost face or reputation, and they believe they can't recover and restore from that. But we also can talk about those bigger issues that we know are young people who feel marginalized and excluded, or who are oppressed by any demographic category, are by that very nature more vulnerable because of the isolation and the feelings of rejection that are both external to them, but then can become internal. So we don't want, when we have the conversation about resilience and problem solving, to remove our eyes from the other work that also needs to be done around actually changing those forces and systems that can contribute to those underlying feelings of a lack of control and a feeling of helplessness or hopelessness. But I'm hoping Samantha or Manny, Jade can share more too.
Yes, I'd love to hear more about the communities with people of color, and what kind of other environmental factors that can be changed that parents may able to utilize as a changing agent, to see if they're starting to see a change in their child. Samantha.
Yeah, I would even start by you definitely want to meet folks where they're at. In a lot of communities, when we talk about our Black and Brown communities, really taking those opportunities to meet them where they are, whether that's church, whether that's school, whether that's the local recreation center, and having these discussions all the time. We also want to think about, too, when we talk about schools, especially in the city, really starting to have those conversations really young. Like, what does it look like when we talk about mental health? What does it look like when we talk about positive mental health and well-being? What are some things that we can do when you're stressed, when you're having a hard time? Who can you talk to? Where can you go? So starting from a really young age, building those components so that as children get older, and as families start to grow, they know what to do as these things emerge. I would also like to add in, when we talk about families of color, the language that we use around mental health and mental wellness, because sometimes it's not the same. So I might be coming from a place of very academic with, this is what I know, I'm presenting this to you, but it is about the language that we use and sharing with families that it's okay, that you're not alone in this, that we are here to support you, and that there are therapists of color, there are doctors of color, there are places where you can go, where you can meet and connect with someone that looks like you, that can share this information and provide that support for you. Places like faith-based communities, again, I know the rec centers are really big, even school and community-based counseling centers. There are so many things that can be done. Just on a community level to meet folks where they're at.
Thank you, Samantha. I know here at MHA of Rochester, we've discussed quite a bit about the trauma of racism. And I wanted to understand a little more from you, Manny Jade, that what kind of effects that could have. And when we start talking about suicide awareness and prevention and what that effect may have on individuals with people of color, what kind of conversations, as they begin talking about racism and experiences of racism, that we can transform those into opportunities.
Okay, I'm back. I don't think my other computer just totally just died on me in the middle of this, so I'm on a different computer. And that is an excellent question, and it's a hard topic. You know, it's an important topic. I mean, our entire country is wrapped up in this question right now, right? So so I don't know if I can answer it all, but I'll give it a shot. At the Racial Trauma Center, we are taking the approach of to add to what I caught of what Samantha said. I wish I caught more of it. Is really listening to what people are saying, and really helping people engage with the powerful emotions associated with their experiences, and doing it in a way that doesn't make the person feel like they have to defend or justify their experience to another person, because the reality is that we don't often know what a person is going through. So in my dissertation work, I worked in one of the largest public housing complexes in Brooklyn, New York, primarily with so black young men and women, and then there were some Latinx and indigenous young men and women also. And this was around the time right after what was the Hurricane Sandy. That area was underwater and without power for about a year after the hurricane. So you can imagine living that way. Right, and then you want to talk about depression and pathologize an experience, right? Describe a response that is a normative response. I mean, if you wake up, I remember a young man called me one day, very upset. He was an artist. The plumbing went out in his building, and the entire floor was just full with plumbing water, really gross, and all of his art got destroyed. And so, of course, he was depressed.
Mhm.
So, well, avoiding that medicalizing of a person's experience and really listening. So that's part of it. And then also paying attention. So we also can sometimes get caught up in the sadness or the hope, the lack of hope or the despair. But if you really listen closely, what I found is if this person is talking to you, there's something there. There's hope there. They're fighting for health. They're fighting for life. And so we may not sometimes be looking at it in a way that they're looking at it. Right. So in terms of intervening and getting involved, often people will tell you, they may not say it outright, but they will tell you what they need. So with the parkour work, what happened, for example, so this is a concrete example. I was doing a study with what we call them emerging adults. So that was like 16 to 30-year-olds. And while we're practicing and studying, because all of the work was outdoors, a lot of the little smaller kids were attracted to what we were doing because we're jumping around and doing flips and it's fun, right? And so they come up and ooh, I want to get involved, and it could be easy to just shoo the kids away. And what we realized was, this is an opportunity to bring them in, so create a sense of belonging. This is an opportunity to hear their stories. They're not going to sit in a room with white walls with the therapist and talk about their mental. It's just not going to happen. It's if anything, it could be very harmful to expect the person to express themselves in a context that is oppressive in the first place. What I found was they would share and they would talk to us if we were out in the community with them. So we're going to the community, we're finding out what they're doing, we're finding out what their problems are, but not only that, what are they doing to latch on to hope, to cling to hope? What are they doing to promote their health? For example, parkour, which parkour is like gymnastics, but outdoors. The people that jump over fences and buildings, it could, people could look at it and say, what is that contributing to anything? If anything, it may look dangerous and destructive. However, the research suggests from around the world that I'm writing up in my dissertation that what that does is that creates a sense of embodied belonging to the environment that you're in. And so there's something called PK vision, parkour vision, which is a form of cognitive restructuring. So looking at your environment, you have all these concrete structures around you. It looks depressing and sad. However, to these young men and women, they see a playground. So they're able to restructure their experience in the environment, interact. And so that's my really long way to say, I don't think we listen enough. I don't think we listen carefully enough. I think we come in with preconceived ideas of what's going on. And that's partially because of how we're trained is to ride in on our academic, chariots and save people. And it's really not effective, in ways that are really meaningful. And so listening to people, understanding their experience, believing them, and then with them, figuring out how to create a sense of belonging, how to navigate the painful and difficult emotions that they're dealing with, and how to get involved. And so what we did in the program, that in my research program, we ended up creating with the New York City Parks Foundation and initially with the NYPD, a program in the parks for free for kids to practice parkour with the older people that we're doing the research with, the emerging adults. And then each cohort is able to teach the next cohort that comes in of the younger kids. And so leadership is modeled, community is modeled, and a sense of belonging is modeled. And we did what they wanted to do. So we didn't come in with something new. It's just, this is what you like to do. It makes you feel good. Let's understand what's at play here, and let's just support that. And so that's one concrete way that these things can.
That's great advice, to listen, validate, support, and then offer positive outcomes. And I wanted to talk with Amy about some of those positive outcomes. I know that you've worked with children for an extensive number of years. What kind of positive affirmations or things of that sort that you offer to parents that would be able to start having those as part of their daily activities for individuals that may be exhibiting some signs and symptoms?
Yeah. I think it's always a balance, right? We have to have eyes and ears wide open. So we can't minimize concerns, but we also don't want to catastrophize, right? I say a lot, I couldn't do this work, really any work around trauma responsiveness or equity work or resilience work if there wasn't hope. And that hope I have to believe inside and out with my whole being. Because if I lose that, how could I possibly help others see the opportunity that there is hope and things can be very scary for a period of time? One of the biggest challenge for, young people who are struggling with thoughts of suicide or are vulnerable to that, and supporting their parent, their caregiver, their primary grown up is helping that adult negotiate that fear, right? We have a visceral desire to protect our young people who we're raising and want them to be well. And sometimes that fear alone kind of puts our blinders on or closes our ears because we almost can't even take it in, right? Because the fear of it really is too big. So we have to have space for our adults also to understand their worries. As Samantha said, meet them where they're at also, and kind of guide and shape the opportunity that, yes, we can address this. And in addressing this, this does bring hope that it can be different down the line. So it's not sunshine and rainbows. It's hard work with practical guidance. How do you perhaps do things in the short term, right? Things like means reduction or greater supervision and personal presence with the young people. Perhaps engage in clinical care for the first time, or seek what is that right fit that's going to work for me and the young person I'm raising. But then over time, continue to evaluate, listen, grow those internal and external resources that allow that young person to meet the challenges in their lives in new ways. Yes, for some young people, that does involve clinical care, perhaps even medication. But that's not it for everybody, right? What are the cultural strategies that work? What is the sense of belonging and community and connection? What are the pathways to greater physical activity? We know that can really help change a variety of sort of internal states, as well as fostering connections outside of ourselves, and the ability to do for others, right? So one of the models of resilience that I really love is the one that Dr. Ken Ginsberg and the American Academy of Pediatrics promotes. It's grounded in positive youth development, but it's the 7 C's. And they're actually now like promoting that we add an 8th C to this model. But it's really simple things like caring, connection, contribution, coping, control. The 8th C that's being promoted is critical consciousness, right? So it's giving people, just really nice, easy, within reach categories of things that they could do and could consider, like, how could we give our young person the opportunity to contribute in meaningful ways? Is that volunteerism? Is it something in school? Because we know when we do, that's a protective factor. It can increase feelings of competence and competence and shape mental models even about how we view our own self and our ability to impact the world.
Thank you, Amy. Another topic that I wanted to discuss was another vulnerable group, which, according to National Center of Health Research, adolescents and young adults are the most likely to consider suicide. And suicide is the leading cause of death for people who are 15 to 24 in age and 25 to 34 in age. So, in addition, suicide attempts are higher among the gay or lesbian students uh, in grades 9 through 12 than among heterosexual students. And the LGBTQ youth are 8 times more likely to commit suicide than heterosexual children. So, what should adults in the lives of children who are part of the LGBTQ group um, know about helping these youth that possibly are struggling. I know you've mentioned belonging, and I know there are many resources in our area, particularly in Monroe County. So I wanted to ask each of you, perhaps you can mention one resource as well as a area of belonging that parents can look into if they do have a youth in this group. And I want to start with Samantha. I know you mentioned rec centers and things of that sort, so I'm eager to hear of some other resources you have for this particular group of people.
Yeah, I was going to say again, it is about that relationship. It always comes back to that. And having someone that they can talk to about how they feel. And I love how Manny Jade said it is about that, not just that external piece as well as that internal piece. It's both. Both contribute to how they're feeling, what's going on in their life, how others perceive them, how they perceive themselves, in the world, that internal working model, and how has that been showed to them throughout the relationships they've had with the adults in their life. There's one resource that I was looking for really quickly. I actually participated in this training a couple weeks ago. We used to have in our community the Out Alliance, which would definitely focus on our LGBTQ plus population, but they have since closed, which is so unfortunate. But some folks from that agency have started their own thing, and they are going around doing trainings for families, for community members, for anyone that works with anyone pretty much that wants to learn more about this topic. And I was just trying to find it, but I can share that more towards the end. But they really focus on how can you not only be an ally to those, but how can you also be like more of an accomplice, so you are that person that's with them, like through thick and thin. You get it, you understand that you might not get it right when we talk about language and making statements all the time, but you will do your best to support them. So while others answer, I will look up that resource, because that is a local resource for Monroe County, and now that we're virtual and beyond, that folks can utilize. So
That is a wonderful resource. I agree. We too are sad about Out Alliance, but excited that they are continuing that mission of bringing resources to our community. So again, if you are a parent and you are looking for more information on that, we'll have a couple other resources for you in this broadcast, but you can also contact MHA of Rochester, and we also have a list of resources. But Amy, I wanted to give you an opportunity to also talk about resources for parents or even young adults that perhaps are struggling in their newer I'll call it dimension of life. Some individuals may have left the home or are going to college or find themselves not fitting in quite in a new job. So I'd like to hear from you a little bit about what individuals can do as far as perhaps a resource.
Yeah. So I'll address like the caregiver, parents, supportive grown up, right? First of all, if you're willing to find resources and support your young person, you're well on your way to buffering that young person from being vulnerable, right? So there is no like genetic tie to suicide risk and being gay or being trans, right? Being non-binary, all of those expressions, the vulnerability lies in internalized stigma or feelings of being rejected, right? So if we have a supportive home life, that already creates a buffering around that young person that can only be accelerated by further research. And it can be organizations like the one that Samantha will share, or PFLAG, and some of those, the Trevor Project, or national bodies. But it can also be, helping your young person see potentials in their identity. Representation does matter. So what kind of media, what kind of books, what kind of positive representative examples that you can give to help your young person really craft their healthy identity that encompasses sort of all their holistic pieces of who they are as individuals. I think if you're a young adult and you are more vulnerable relationally to your identity, maybe you don't find connections easily, or you have internalized shame and stigma about who you are, connecting with those formal resources, others who identify similarly to you, can help create that sense of community and those positive feelings of identity and belonging. But that ultimately, we know there's such a factor of the family you create, right? How can you actively seek those relationships that fulfill you and support you, who see you? That's such a powerful thing that we have as humans. I see you and I welcome you in my whole heart. Sometimes those are the families we're born in. Sometimes those are the families we come to, and sometimes those are the families we need to create for ourselves.
Well said, Amy. Thank you. I did want to share the resource that Samantha did share, the Safe Zone Initiative, and that can be found at the szinitiative.org. So that's a great resource, and we'll put up Amy's resources of the Trevor Project, and I believe the other was PFLAG, correct? Okay, excellent. And I'm looking forward to hearing Manny Jade's answer. I know we've kind of already given some really great resources, but I have no doubt that you'll have one that we've not heard of yet, given your experience and wide breadth of knowledge outside of Rochester. So some of us may not really be in Rochester right now, but looking forward to hearing resources, perhaps again, for individuals that are perhaps a minority and part of the LGBTQ movement.
I had some things prepared on my other computer that is not working right now. So, I mean, what pops to mind in New York City is the Beam Center. It's just, I can't say enough good things about it. And when I'm not talking, I'll look for the link and I'll share it. Just a wonderful organization that's really community centered. And this weekend, for example, they're having a remix, mental health remix, and there's dancing and there's music and there's fun and there's sharing. And so it's fun. And I'm going to say it's fun for adults. And so here's what I've learned. My daughter is 16 years old. And this November, her best friend committed suicide.
Oh.
And so we're dealing with it in the home right now. My daughter is identifies as lesbian, and now is also unsure of her gender identity. And so what I really love what Amy said. Everything Amy said, my heart was just exploding with happiness, because what I realized is we are resources. We can make ourselves into resources. And what I said about it being fun for adults and maybe not kids is that my daughter is in a very different, her interactions socially are very different than the way I interacted when I was that age with the internet and TikTok. And then she got involved in a live streaming community, which I never, I don't really understand exactly how it works. However, she's formed a community of LGBTQ friends from around the world, and they watch movies together, they sing together. My daughter and I like to sing, so I'll come in the room and like do a little thing, and they all, oh, I love your dad, and then we'll talk a little bit, and it's very brief interactions of maybe making jokes, making light of the confusion surrounding. So the thing I'm dealing with, gender identity things this year, is I'm 47, and I'm like, maybe this is an issue with me that I need to look in. So being able to lighten it a little bit and talk about the confusion, and all I really had to do there was buy her a computer that worked well, and I need one too now. But buy her a computer and a microphone and a camera and some lights and the things that she really, really wanted it and kept asking me for it. I don't totally understand why she needed it at first, but did what she asked. she's built this community that she's really connected with. And we've talked about doing some things in the community, like having discussions among her friends. As a parent, I was surprised to find out how many parents just don't interact with their children on these topics and don't really know what's going on, don't know the confusion that their kids are feeling, even in an affirming environment. Like my daughter's in a very affirming environment, she still has a lot of doubt, a lot of depression, associated feelings of rejection and confusion. So Beam Center is a great one. I'll send the link. And then just turning ourselves into a resource, looking for opportunities to be there for the people we're interacting with, the children, young people that we're interacting with. And again, I keep circling back to just really listening to what they're saying.
Well, you mentioned, finding those emotions of happiness and joy, singing and dancing, and finding those moments in which we can truly express ourselves and feel. And I think that goes a long way for not only the individuals who may be struggling, but even the individuals around individuals who are struggling. So if we can create those moments that aren't so tense, the conversations don't need to be all serious all the time. There can be some levity when we talk to our children. I think that would really promote a sense of the conversation beginning with our own children. So I really appreciate all of you taking the time to give us your best resource in that most vulnerable group. I did want to continue our conversation as we do, again, bring that message of hope. We do all believe that suicide is preventable, and that our hope is to amplify the message for our viewers that they are not alone. And anyone listening who are feeling these feelings of struggle and helplessness and hopelessness and not wanting to burden anyone, please reach out. So I did want to give the suicide line. I know many of us feel at times that they're alone, no one's going to understand, or perhaps don't want to burden anyone with our particular feelings. So I did want to give the lines. There's two of them. One is 1-800-SUICIDE, which is 1-800-784-2433. And the other is 1-800-273-TALK, which is 1-800-273-8255. So we will have those up for individuals to view as we move forward towards the tail end of our conversation here, in case you are recognizing that you perhaps are feeling some of these signs and symptoms, and now is the best time to reach out and talk to someone about that before they continue to escalate into something that perhaps isn't something that you're welcoming or wanting to handle on your own. So with that, I did want to continue to ask our panelists, for children who perhaps has a friend. Manny, Jade, you just referenced that, where you have a friend that perhaps is contemplating suicide. What would you recommend for a friend to do as somewhat of I'll call it an intervention? Who should they reach out to in order to gain some assistance in perhaps approaching someone that has confided in them that this is something they're thinking of? And I'll start with Amy on this topic.
I think it's a careful balancing act, and especially depending on age and developmental stage. So we do know that suicide can happen in our, very early on in elementary, more so than probably we as adults are really comfortable with. And certainly thinking about our peers in elementary all through, middle and high school years, then what is their ability to see shades of gray, to be support, but to also have good boundaries for themselves. How do you really be a caring friend, but also not completely immerse yourself through that love and care you have in your friendship into their world and into their challenges? So I'm always a fan of early prevention. What are we equipping all young people with in conversations that begin ideally in their homes when they're little, all the way up through our more formal opportunities to connect with kids, is like schools, rec centers, community-based organizations, etc. So I want to do both. I definitely want to make sure that all our young people know that it is normal to struggle, right? It's not the TikTok, Instagram perfect world. We are going to have moments in challenge for all of us. Those moments don't necessarily last. So one of the things I do in my own home, I'm a parent of two, is I talk about how emotions wax and wane. Even good emotions don't stay together. Negative emotions, what we term negative emotions, don't stay forever, right? So we're talking continually about, like, we move in and out of these feelings. But if we do see in ourselves or someone else that these negative kind of heavy things are sitting, what can you do as a friend? I love you. I can listen to you. And also I can make a warm handoff. Here's somebody who I trust. I want you to feel well. Can I go with you? And that might be a parent, an adult in your home. It might be somebody at school. It might be a faith-based leader. But kids will listen to kids, right?
Mm-hmm.
And don't be sworn to secrecy. And maybe if that friend doesn't have an adult, maybe you can be that bridge to help expand their circle so you can stay their friend, but they can actually have sort of a bigger variety of people lending their support to them.
So one experience that I have seen work is having a person that has confided in another person ask the person who confided, um, letting them know this is really something that we should talk to someone about. Is it okay if I mention it? Or can we go together to talk to Mr. or Mrs. So and so, whoever that may be. So I love exactly what you're saying, Amy, because I think that there are more opportunities than we tend to give credit for when individuals are experiencing this struggle. So Samantha, I wanted to talk to you also about the youth issue as far as trusting another individual. I know individuals tend to not necessarily want to talk strictly to parents, and you've brought up a great resource when we talk about community rec centers and churches. How would one go about in really even bringing this subject up outside of the home?
Yeah, so it's really important. I have 4 boys, that as parents and adults in young children's lives, to really get over the fact that we want to be that person for everyone. There are times when our kids or kids that we are close to do not want to tell us what's going on, and they need to have that other identified adult or person that they can talk to about what's going on, whether that is their coach, whether that is their best friend's parent, an aunt or an uncle. So again, we want to instill those messages from very, very young, really early on, that if it's not me that you can talk to or you feel that you can't turn to, please turn to someone, because like we've been saying, you're not alone. And it is about that connectedness. And it's about us being the adult saying that's okay, that we're okay with you reaching out to someone else for support. At the same time, letting them know that, yeah, I might, my face might look a certain way if you say certain things. Like, that's just my face. But I am here to support you. Like, we can get through this together. and knowing as the adult, you're not alone in this situation, that there is a whole community out there and a whole host of resources out there, such as NAMI, that can support those adults who have young children or even adults that are struggling with these thoughts or feelings around what do you do for self-care for yourself? How do you even have this conversation? How do you talk to your spouse or your partner about this? It's hard. So really making sure that you have that self-care piece and that you let the kids know in your life or those youth in your life that I'm here to support you. And there's also other resources out there for you as well. So you're never alone in this, and that recovery is possible.
That's a great answer, Samantha. And I know we're about to wrap up. We've got a few more minutes here, but I did know about your fundraiser tomorrow, which is the Walk for Suicide Awareness and Prevention. Wanted to give you an opportunity to talk about that because I'm understanding it's not too late for people to sign up.
No, it is not too late for folks to sign up. Our NAMI Walks annual fundraiser is tomorrow. Unfortunately, it is a virtual walk again this year. Boo to COVID. But we have a lot of different spots around town, around the greater Rochester community that different groups have put together. If you want to join them, they are listed on our site. It is not too late for you to sign up and develop your own team. We are going to have a cookout for my family. We're not doing a walk. We're just going to eat, which is probably not the healthiest thing. But we have other folks that are doing a hike at Cobb's Hill. Some folks are doing things at our local coffee shop, the Ugly Duck. So again, there'll be lots of things around the community, but check out our website, namirock.org, and you will see that list where you can donate, or even if you just want to become a member at no cost, that is also an option.
Excellent. I was talking with Heather Newton, the CEO of NAMI, and talking about walking my dog. Either way, I'm walking tomorrow. So if you're walking your dog, please think of giving to NAMI, because it is a worthy organization and such great support to our community. So I did want to thank all of our guests here today, and want to let you know that we've put up some great resources, but there are still even more of them. Of course, I just want to take a minute and mention MHA, Mental Health Association of Rochester, as one other option for supportive resources. But again, if what we've provided today really isn't in your area, please feel free to reach out to 211. There are other resources that may be a little closer to you, or be able to lend a virtual lens so that you would be able to receive the resources that you're looking for. So please don't lose hope. There's a lot of help and support out there, and we are so grateful to all of our guests today in mentioning all of them. Thank you and enjoy your day. Bye-bye.